good evening and welcome to our favorite talk show with me, Msonda Kasonde, your friend and partner in health issues. Thank you so much. If you have not yet shared this page, share with somebody because today's topic is very interesting and I'm sure you are going to love it because it's going to sort out maybe some of your problems or your friends' problems, your husband's problems. Okay, because when the husband is in trouble, means even the wife is in trouble. Probably it could even be your wife complaining about the same thing. So share this page, let somebody know that our favorite program, our favorite Facebook talk show, Your Health, Your Choice with me, Msonda Kasonde, is on just right now. Make sure that you also call somebody to participate, send a message, send some questions, and make sure that you are also participating in this program because it's for you and me as we are partners. I've always told you that you and I are partners. Our topic today is a hot one. We are talking about this hot issue. So before we commence discussions, just share this page with somebody. If you are tuned in, share it with somebody, let them hear for themselves as well, and let them be able to comment on this page. So very important. I welcome you. Today is Wednesday. After today, I'll see you again on Friday at 21 hours 2020. You can see somebody's watching there. We have a hot issue to discuss today. I hope you will call somebody to tune in to just look for Living Hope Clinic Zambia. Then you'll be able to get us live and direct to you. This program is for you and me, is for us to help each other live healthy lives. That's why we call it Your Health, Your Choice, because it's the choices that you make in life that will make you be healthy or unhealthy. Very, very important. So our hot issue today, we are talking about the men's issue. We may not finish today. We can also continue with it on Friday. So we are talking about erectile dysfunction. Okay? Erectile dysfunction. In short, it is called ED. Okay? So if you have ED, you should tell your doctor. Okay? Because ED is also a sign. It's a sign of other health problems that you might have. So we are talking about, just in case you're just tuning in, we are talking about erectile dysfunction, a condition that is found in men, erectile dysfunction. I've received quite a number of men that have come with some of these issues and they are really devastated. Sometimes you find a couple bringing themselves, my husband doesn't do this and that, my husband doesn't take long, and all that. So that's what we are going to talk about today. And like I said, I told you that if you have erectile dysfunction, make sure that you tell your doctor. It's simply a sign of other pre-existing conditions. So don't take it literally like that and you start taking concoctions to just stimulate yourself. It will not be healthy. You could be missing out some serious condition that could be causing some serious underlying condition that could be causing the problem. So erectile dysfunction, we can't say it's a disease on its own or it's a diagnosis on its own that should be treated in isolation. It should be treated with other pre-existing conditions. That's what could be causing the erectile dysfunction. So what I want you to understand is that erectile dysfunction may just be a sign that there are other serious conditions that may be existing and manifesting through erectile dysfunction. So it may mean that if you have erectile dysfunction, it may mean that your blood vessels are clogged up, or it may mean you have nerve damage. Your blood vessels may be clogged up with a lot of cholesterol crystal, with a lot of fat. Your blood is very thick. So in those small erectile blood vessels or blood vessels that lead to erectile tissues may be very small. And so if they are even clogged up with cholesterol crystal, you find that the fresh blood flow cannot flow there to be able to sustain an erection. Very, very important to understand that. That's why I'm saying it could be that there could be other underlying problems that could be causing the erectile dysfunction. So what can cause the clogging up in your blood vessels, especially those that are leading to the erectile tissues so that an erection can be maintained? It could be that there is too much cholesterol, there's too much fat in the blood, or your blood vessels are stiffened up. The other condition that may be existing that I call silent conditions like diabetes. It could be that you have diabetes and so it is causing damage to your nerves that are sensitive, okay, that are responsible for sensitivity when you are touched. If you don't see your doctor, these problems may remain untreated and you keep trying a lot of things. You try this, you try that, you drink that, all the concoctions, you may finish them. All the stimulants that you would want to use, you may finish them, just simply because you're not treating the underlying conditions that could be there leading to erectile dysfunction. There may be several treatments for erectile dysfunction, but to some, it may just mean that you just need to be detoxified to allow free blood flow in your body. And if we say the blood vessels could be clogged up, it's not only the blood vessels that are leading to your erectile tissues. All the blood vessels in your body can be clogged up, and you may even develop hypertension, okay? So it's very, very important that when you have an issue like erectile dysfunction, I have had a big problem with some patients. When you give them probably like some drugs like cholesterol control, okay, you just want to clean their body, remove a bit of fat. For them, they just want something specifically for erectile dysfunction. Like I am saying, it's just a sign that there is some underlying condition like diabetes that can be causing the erectile dysfunction. There could be underlying cases like probably the prostate enlargement that could be interfering with your ejaculation. So such things. So when we do some investigations, there are a lot of things that we'll come up with. If we do a full body scan, probably we'll even discover that there is prostate enlargement, there is prostate calcification, there is prostatitis, there is fecal colon impaction. Okay, all those things are supposed to be looked at and see what could be causing the problem. We can also look at your blood vessels, the blood content. Is there too much cholesterol? And not just cholesterol alone, as the cholesterol also been crystallized, has it hardened? Because you know what happens when you have an erection, okay? When you are in that act of sexual intercourse, what happens is that there is extra blood flow of about 80 to 200 extra mils of blood that should flow to your erectile tissues in order to sustain an erection. If there isn't that flow of extra blood, you cannot sustain an erection and you may be experiencing premature ejaculation or weak erection because this erection will be sustained by the extra blood that is flowing to your erectile tissues in order to sustain an erection. So it's very, very important that you understand some of these things so that you don't treat yourself wrongly. Like I said, if you are experiencing erectile dysfunction, the best that you can do is to see a doctor so that you are investigated on what is happening in your body that is leading to erectile dysfunction. Like I said, erectile dysfunction is simply a sign, okay, that there is something much bigger than just erectile dysfunction. Probably somebody can be wondering and thinking like, what is this erectile dysfunction? Erectile dysfunction, it is simply the inability to attain or maintain an erection sufficient to permit a satisfactory sexual intercourse. Erectile dysfunction is the inability to attain or maintain an erection sufficient to permit a satisfactory sexual intercourse. That is erectile dysfunction. That's what it means. So in the past, it was referred to that. I was saying It is the inability to attain or maintain an erection sufficient to permit a satisfactory sexual intercourse. That is erectile dysfunction. So in the past, I was saying it used to be referred to as impotence, it used to be referred to as loss of libido, premature ejaculation. So when you have impotence, it means one is experiencing things like loss of libido, premature ejaculation, inability to achieve an orgasm. About 70% of the men are affected. So when we talk about erectile dysfunction, what we are talking about, it is the inability to attain or maintain an erection sufficient to permit a satisfactory sexual intercourse. So in the past, it used to be called impotence. So in impotence, you experience the following: loss of libido, appetite to have sex, okay, to have sexual intercourse, and premature ejaculation. You also may be experiencing inability to achieve an orgasm. You find that about 75% of the men are affected by this. It's just that sometimes men can be shy to talk about some of these things, but I want you to know that it doesn't pay to hide or to feel shy about this. Like I said, it could be a sign of other underlying conditions like diabetes or hypertension, or probably a cancer, prostate enlargement. So it's important that you see a doctor. Should you experience loss of appetite for sexual intercourse, should you experience premature ejaculation, should you experience inability to achieve an orgasm, please see a doctor so that we can do some investigations that will help us discover other conditions that you may have that have been silent for a long time until they bring up this kind of a problem. Now, the frequency of erectile dysfunction also increases with age, but age is not a cause of erectile dysfunction. What happens as you are growing, it is the force and the need to ejaculate that decreases as you are growing, because probably you are becoming busy with a lot or other important things to do than concentrating on sexual intercourse. Otherwise, the capacity to have and maintain an erection is retained up to even in your 80s. So if you are 50 years, you are 40 years, you are 60 years, you are experiencing any of these, it's not that it's because you are growing old. No, age is not the cause of erectile dysfunction. What happens as you are growing old, like I said earlier on, it is just the force and need to ejaculate that decreases. Okay? You are busy now, but the capacity to have an erection, a proper one, and be able to maintain it is retained up to the age when you are 80 years old. So probably we have parents who may have lost the spouse or the wife, and they are thinking of getting married, and they are maybe 70 years old. They can still have proper sexual intercourse. They can even have a child. So if a parent asks you to say, me, I want to marry another woman, don't even say, oh, you don't do that, because they are still energetic. They can still sustain an erection. They can still satisfy somebody sexually. Very, very important. Just in case you are just joining us, we are talking about erectile dysfunction. Very, very important. Erectile dysfunction, simply the inability to attain or maintain an erection sufficient to permit a satisfactory sexual intercourse. They used to call it impotence in the past, but this is what you experience as you are saying, I have erectile dysfunction. What you may be experiencing is loss of libido, it may be premature ejaculation, it may be the inability to achieve an orgasm. That's what you may be experiencing, and that's what we are referring to as erectile dysfunction. Very, very important. And I was saying, in simple statistics, we're saying about 75% of the men are affected by this erectile dysfunction. So when you experience this, like I said, I told you that you need to see a doctor, because this is simply a sign that something that is hidden, that is silent, could be playing an important role in leading to erectile dysfunction. So whenever you experience some of these things, simply see a doctor and be attended to so that more investigations are done. I told you that there may be several treatments, okay? Several treatments for erectile dysfunction. But to some, it may just be taking one type of drug and it is cleared. Others, it is getting more exercise, do a lot of physical exercise to burn the excess fat. To some, it's just losing weight, or just stop smoking, or stop taking too much alcohol. Then you may not even need any medication. Also, probably just improve your balanced diet. With the men, your reproductive system, if it has to be functional, it's so much dependent on your nutritional status, on your diet, what you eat. If you are so much into junky foods like chicken and chips, chicken and sausage, the cola drinks, the soft drinks, the sugar, the artificial sugary foods, definitely any of these symptoms that I'm talking about, like loss of libido, premature ejaculation, inability to achieve an orgasm, and if you want to be among the 75% that are experiencing erectile dysfunction, keep on leading such a lifestyle where you just eat junky foods in the morning, junky foods for lunch, junky foods for supper. You wake up the following day in the morning, it's alcohol, you're smoking. Definitely any of these signs and symptoms that would lead to erectile dysfunction will be a part of your life. Like I said, the treatment may not even be as complicated as you may think. And then the other thing that I've noticed is that people come to the clinic after they have used a lot of concoctions that don't even have a dosage, that they don't even know how long they should take it and when they should stop, or the dosage, how much of the teaspoons, or how many tablets should they take. When they have finished that and they have stopped responding to those tablets, that's when they will come to the clinic, when they are completely finished. And that will take long to reverse some of these things, because especially the tablets that you take, like the Blue Diamond, there is also the Kill Me Quickly, I don't know the other tablets that you may take, even some of the herbals, because the other problem we have had is where you want to share your experience when you had any of these symptoms and what you used and it worked for you. To some, it may not be premature ejaculation, okay? To some, it's the inability to achieve an orgasm. To some, it may just failure to ejaculate. They can't release anything. They can sustain an erection. They can hold it as long as they want. But when it comes to ejaculation, they are failing. So if somebody had loss of libido, meaning loss of appetite for sexual intercourse, the other one had the appetite, okay, and they are able to sustain an erection, there's no premature ejaculation. You can't take the same treatment because the underlying cause is different. So the fact that they responded when they had loss of appetite, and you who has premature ejaculation, but the appetite is there, if you take the same medicine, it may not work for you. That's why you need to go to the clinic and explain your problem properly, so that the underlying cause is identified and treated correctly. That's what we need to do. So some of these tablets you take also, they are addictive. Probably you will buy today, you will use one, okay? You will use one tablet and it will give you the effect that you wanted to achieve. Tomorrow, for you to achieve the same excitement that you had yesterday or the other day or 2-3 days later, you will find that you may need 2 of those tablets for you to achieve the same effect. If you continue taking it, you find that you also start increasing the dosage until at the end of it all, you find that even the tablets that you've been taking, despite increasing the dosage, you find that they are not working. There is no response. You are not getting the effect that you are looking for. You are not getting the intended effect. So it's very, very important that when you start experiencing such problems, make sure you seek expert medical attention so that things are explained to you. Sometimes it could be that psychological, okay? Sometimes it could be other conditions, like probably you have high blood pressure, or maybe you have diabetes, or you have prostate enlargement. All these things can lead to erectile dysfunction. So if we are able to treat your high blood pressure, if you've been taking high blood pressure drugs for a long time, you find that you start experiencing such problems. So the solution is not for you to start stimulating yourself. The solution is to see how the high blood pressure drugs can be removed so that you stop suffering from these side effects. If it's because of diabetic drugs and diabetes itself, it's important that we know how to maintain your sugar levels in normal ranges, and also find a permanent solution to make sure that we remove the downy, or we remove the metformin. Some of you can even be experiencing some of these problems as I'm talking right now. If you have any of those problems, make sure that you see the doctor and let them do some investigations that will lead them to the appropriate cause of your erectile dysfunction. Remember, it is a sign. Okay, so we've just talked about what it is and how it can present, and some of the causes have been mentioned. The other important information, we'll talk about them on Friday. For now, we end here. Thank you so much for tuning in. We'll see you after tomorrow. Make sure you share the page so that other people can also learn. Good night.